It's 1:30, so I think we'll get started. I hope everyone can hear me. I see some new faces and names on the list of attendees, and so I'm just going to reintroduce myself. My name is Marissa Young. I'm an associate professor in the Department of Sociology at McMaster University, and I'm also currently the acting director for the McMaster Institute for Health Equity, as well as the lead and director of this initiative for advanced research on mental health and society, or what we have come to refer to as ARMS. Because there are some new faces, I'm just going to recognize that before we get started, gathered on a virtual platform, it is important to recognize we acknowledge that the city of Hamilton is situated upon the traditional territories of the Erie, Neutral, Huron-Wendat, Haudenosaunee, and Mississaugas. This land is covered by the Dish with One Spoon Wampum Belt Covenant, which was an agreement between the Haudenosaunee and the Anishinaabe to share and care for the resources around the Great Lakes. We further acknowledge that this land is covered by the Between the Lakes Purchase, 1792, between the Crown and the Mississaugas of the Credit First Nation. We are very excited to host the following panel discussion, which will offer an opportunity for community organization representatives to outline their experiences working with McMaster University on various mental health research initiatives, as well as an overview of programs addressing mental health needs during and post-pandemic, the COVID pandemic, and potential resources from the academic world that might help foster their mental health-focused programs. I am excited to introduce the moderator for today's panel discussion, who is Leora van der Linden, the program manager for the Community Research Platform at McMaster University. Prior to this, Leora worked for over a decade at the YMCA, and before that, managed the Newcomer Youth Leadership and Refugee Youth Leadership Development Programs in Toronto. So just a reminder before I turn it over to Leora, all questions should be directed towards her using the chat function, which you'll find on the left side of your screen. And now I'll thank all the presenters and Leora especially for your moderation. Turning it over to you.
Thank you so much, Marissa. I appreciate it, and thank you for the opportunity to organize this panel. I'm really excited about it. So as Marissa mentioned, I'm the manager of the Community Research Platform, and this is a fairly new initiative at McMaster. It recently got recognized as a core research platform at McMaster, and it's a joint initiative between the Faculty of Social Sciences and 5 community organizations, 2 of which you will hear about today during this panel. And at its core, it's really about bringing together academic researchers, students, and community experts who are working on areas that overlap and align, and to share resources and infrastructure to build capacity and to really do research that has a social impact and responds to needs and aspirations of our communities. And so you'll get to hear a little bit about some of the projects that we've been doing collaboratively over the past 2 years. So again, I want to welcome all of our panelists, and just a reminder to everyone to please make sure your microphone is muted, because if it's not, anyone who's sitting near you will be able to hear any sounds that are sort of from your background. And as Marissa mentioned, if you have any questions, we have a question period at the end, and you can direct your questions to me in the chat, and I'll be able to put those to our panelists. So first, a brief introduction. We have on our panel, we have Sue Phipps, who is the CEO of the Canadian Mental Health Association, the Hamilton branch, and the CMHA Hamilton is also a founding partner of the Community Research Platform, and Sue sits on our steering committee. We have Lisa Weaver, who is the Director of Collections and Program Development from Hamilton Public Library, and Lisa is also a member of our steering committee. We have James Gillett, who's the Associate Professor in Health Aging and Society, and also the Associate Dean of Research and Grad Studies, and the Academic Director for the Community Research Platform. We have Caitlin Winia, and she is a postdoc in Health Aging and Society, and also a researcher in residence at Hamilton Public Library. We have Rachel Van Every, who's a PhD candidate in Health, Aging, and Society. And finally, last but not least, Diana Singh, who's a postdoctoral fellow in sociology. So thank you again to our panelists. So as we delve into this panel, I wanted to sort of set the context for this conversation. So as we all know, the COVID pandemic and all of the related public health measures have put an incredible amount of strain and stress and anxiety on all Canadians. But we also know that it's had a disproportionate impact on some Canadians. So just to give you a few examples of what some of the latest research is saying, and others who are looking at the impact of COVID. So recently, the Toronto Foundation's 2021 Vital Signs report warned of an alarming increase in mental health challenges for children and youth, including increased rates of anxiety, depression, suicidal ideation, and eating disorders. The Canadian Women's Foundation has warned that the pandemic is having an unprecedented impact on the mental health and well-being of women and girls, and especially racialized women, newcomer Indigenous women, and women with disabilities. They've experienced disproportionate job loss, increased burden of caregiving and housework, and increased risk of gender-based violence, and all this with reduced access to support services. And according to a recent StatsCan study, 7 out of 10 healthcare workers who participated in an online crowdsourcing initiative on the impacts of COVID on healthcare workers stated that their mental health was worsening during the pandemic. And we all know that the impact has also been felt by other frontline workers, like those working in grocery and essential retail, teachers, and library workers. In fact, a recent U of T study, which surveyed more than 500 librarians in Ontario, found that almost all respondents, who were predominantly female, witnessed or experienced violence, intimidation, and harassment while working in libraries during COVID. The Canadian Centre on Substance Use and Abuse and CAMH, among others, have published findings on increased substance use during the pandemic. And when the world shut down, everyone was told to stay home, and those experiencing homelessness were suddenly much more visible. Experts note that those without housing are at a much higher risk of contracting and spreading infectious diseases than those with stable housing. So it is within this context that community organizations and public libraries have been operating. Forced to quickly pivot many services and programs online while still maintaining essential programs in person, community organizations and public libraries remain vital spaces supporting community health, well-being, and resiliency. This is also the context under which most of the CRP's, the research platform's collaborative research, has been undertaken. So with this in mind, I want to turn to our panelists, and you're going to hear a little bit about what's been happening at their organizations, the work they're doing, and the role that research has played in helping to support their work. So Sue, if I could direct the first question to you, so if you can unmute your mic. Can you share a little bit with us about what life has been like for CMHA Hamilton during the pandemic? What's changed, and how has your partnership with McMaster helped CMHA to respond to the crisis?
Okay, thanks, Leora, and thank you so much for having me here today. It's so nice to be able to be here and to share some of the experiences that we've undergone through this global pandemic. It's been quite an interesting situation. Certainly one that I actually went to school at McMaster in nursing school, and I remember learning about pandemics and definitely never thought I would ever have to address this as a leader in healthcare. So it's been a steep learning curve, we'll say that. I'll tell you a little bit first about Canadian Mental Health Association, just so that you can understand the kind of work that we normally would do. So we are funded for frontline services. We provide mental health services to individuals who are 16 years of age and older with a serious mental illness and or concurrent disorder, so a co-occurring substance use disorder. And we provide a whole range of services, so mental health promotion and resilience services, and that could look like some education, hearing stories of people with lived experience to reduce stigma. We have a range of supportive housing, including residences and so on. Court support services, we do release from custody, we do diversion, we support people coming out of forensics from the hospital, and we do case management. We also have a primary health care clinic for people experiencing homelessness that has physicians, nurses, and psychiatry attached. We also have a lot of recreation groups that we run, both in the community, at rec centers, and in churches, and also at the lodging homes, otherwise known as residential care facilities. You've probably heard quite a bit about that in the news as well. Because those individuals living in residential care facilities were really impacted by the pandemic as well, being a congregate living setting. So they were in a higher risk group, as well as those experiencing homelessness, as Leora mentioned. So when the pandemic hit, of course, we were all directed to work remotely from home. So we quickly shifted, and thankfully we did have the capacity to do that. And within a week, we were all working from home and providing virtual care. And now virtual care worked for some, but I will tell you that it did not work for all. And this was a huge concern because many of the folks that we serve really do not have access to devices and to data and to internet and to the things that they needed, even safe private space to be able to conduct any kind of service or to receive any service remotely and virtually in that way. So what we had to do was very quickly pull together a street team to go out onto the street. And so we actually took our nurses, because what we were hearing from the community was that there were many, many people living in encampments that had some pretty significant health issues that were not being addressed, and they weren't finding the ability to access health care at all during the pandemic because of their circumstances. And so we also initiated a peer support team. So the peer support workers, and the nurses went out, and that was a nice way to kind of connect with people living in encampments and experiencing homelessness. We even, had nurses attend the hotels where the overflow was happening, because what they had to do is they had to space out the number of beds in shelters, and so that limited the number of beds that people, actually could access in the shelter system. So that actually then, kind of shifted people out of the shelters, and then they had to find somewhere to go. And so some people ended up in encampments, others ended up in hotels, and so we had a team working to support those folks. The other thing that we noticed, of course, was the acuity. So people, became more and more unwell, and we've heard about this all through the pandemic. And part of that is also because people just didn't have the normal protective factors in their lives anymore. So the things that our care providers, our mental health workers would normally, kind of encourage people to engage in, like, physical exercise, connecting with family, going to the library to access the internet, to job search, to find activities, recreation activities, and things like that that would really promote their mental health. Those things were no longer available to them. So they were very isolated, very, very alone, and really feeling disconnected from community. And so because of that, they started to become more and more symptomatic, and we've heard about how there has been an increased burden on emergency rooms with more people coming in with substance use disorder related concerns, increasing opioid overdoses. We've heard about, the mental health related ED visits really going up, and increases in eating disorders in youth, for example. And then, of course, the incredible stress on the healthcare workers as well. And as we've also heard from Leora, educators and library workers. So everybody was under, intense amount of mental distress because of the pandemic for all kinds of reasons, and even our staff. So what we were noticing, and a call that came from our community partners as well, was that people working the front lines were trying to juggle parenting, because largely a female-dominated profession working the front lines and being care providers. They were trying to juggle parenting, remote learning for their kids, and also simultaneously working from home with some really, really acutely unwell people. And this was just, so much more than they'd ever had to cope with before, and continue to cope with now. So we had to really think about, how do we care for our people who are caring for the people that we serve. And so what McMaster has been really instrumental in supporting us with is looking at some of these newer programs that we launched. And one of them was a skill building support for healthcare workers, educators, and library workers. And then the other was, of course, our street team with the peer support workers and RNs. And then we started this pilot project, which was to actually work with 3 different groups: housing, health, and hospital, to come together in an intensive support pilot. And McMaster helped us to evaluate that project, as well as the skill building support for the healthcare workers and our peer support team. So lots of unique things that McMaster has been involved with. The other thing, too, was really to look across the board at mental health workers and how the COVID-19 pandemic was impacting them and their work and the emotional labor that was involved with having to navigate everything that I've talked about here so far. And so we were able to actually survey 11 CMHA branches across Ontario. So CMHA, as you know, we are a Hamilton branch, but there are 30 branches across Ontario. And we were actually able to get a really great response rate and learn about how the pandemic has impacted our mental health frontline workers. And from that, we're going to be developing ways to support. So this is an ongoing project, a very big project, led by Dr. Diana Singh, and I'm sure she's going to tell you much more about that. But that was one of the projects that we've been working on. And so I think what it has helped us to do, because we are funded for frontline, we're not funded for research or for evaluation. It's allowed us to be able to do that at a time when our resources were really quite stressed, and we wouldn't have had the capacity to do that internally at all. So what I've seen Community Research Platform do for us is really to bridge and lessen that divide between research and frontline practice, to be able to build some capacity internally to analyze our real-time data so that it can inform how we improve the services that we're delivering, particularly the newer services that we don't know as much about. And it's research that's relevant. It's relevant to our frontline, because oftentimes, when our frontline workers go to hear new research and so on, what tends to happen is either A, it's not super relevant to what's happening, day to day in their lives, or maybe it's something that is sort of common sense that we kind of know already, and it's like maybe it's validating, but it may not be sort of amazingly new information for us. And I can give you a funny example of that. I remember when cannabis became legalized, and all of a sudden there was this research about how cannabis could be used as a harm reduction strategy for people who use opioids to help them to reduce their opioid use. And, most of us who've been kind of working with people who use substance for decades, I'll age myself here, kind of thought, well, we knew this back in the 90s. If you asked any person who used substance, you would know that is what they do. So this is where sometimes there's a disconnect between what's happening in research and what's happening on the front line. And I think that having this platform enables us to be able to bridge that gap and to really do research that's quite relevant. So I'll stop here. Thanks, Leora.
Thank you so much, Sue, for that. And you will have an opportunity to hear from Diana and then James and others who've been involved from the McMaster side about, how relevant it's been from the McMaster side and for researchers to have that direct connection with those who are working on the front line to help bridge that gap. Before we get to that, though, I want to move on to Lisa. And so, Lisa, as we've been talking about already, library workers have worn many hats during the pandemic. So in Hamilton, actually, many were seconded by the city to help with the immunization campaign, while others were running programs online and others were still in branches offering some essential services. So really the whole gamut. How is HPL addressing the health and well-being of both library workers and those that you serve? And how has the research partnership helped to support the work that you're doing?
I think our biggest challenge was, and I would have to echo everything that you and Sue have already shared, we're funded for front of house service. We don't have that much backroom operations at the library except for cataloging books. And so the strength of our services when we were closed for 3 months physically, both our collections and our spaces, the gap just became so evident because we were regularly hearing from members. We started an online virtual reference service, and members really just needed a space to go. People, and Sue alluded to some of the people who live in rooming houses, people who live on the precariously, the library is their space. The library is their space for the washroom, for computers, for water. It's just a place to sit for a little bit. That's different from the space that all of the space that they're in all the other times. So to have that space gone for 3 months was huge, and there was nothing that we could do about it. So we were fortunately able to open again in June 2020, and both for the staff and for our membership, it was a relief, but also a huge learning. And again, like Sue I would echo everything that Sue said, just from a library perspective. We would never have imagined ever what we have experienced since June 2020. Many of our members have come back, but many of our members have not been able to return because we have a mandatory mask mandate with no exceptions currently at this time, as per the direction that we've been given from the city and province and different agencies. And so we continue to offer curbside to some members who still aren't able to access our spaces. And we're looking forward to the continual changing of government regulations, including hopefully an announcement today that's going to show us that roadmap out of pandemic responses the way that they're slated right now, so that we can continue to welcome more people back, members who are desperately still missing our spaces and our services because they still continue to access us through curbside. Our staff missed our members either equally or more than our members missed us. And so it has been very taxing for them too. Again, as Sue said, in addition to caring for all the responsibilities at home, whether it be illness or schooling, our staff returned to frontline services to support our members with all of those supports as well. So in addition to new services like print on demand, the virtual service, the grab and go bags, loaning iPads, we've also spent a good chunk of the last month laminating passports, because many of our members don't have access to technology. And so for those of us who have been fortunate enough just to simply download that passport that we need to meet a friend for coffee, that has been an additional barrier for a lot of our membership, and our staff have been actively involved with that, in addition to actively being involved with their families for providing that support. And so the community research platform, really front and center, has been our health and wellness response, in addition to the extended family health and wellness programs that the library provides just through our regular benefits plan. But McMaster's, the community research platform led by Dr. Diana Singh, was able to support our staff through some survey questions to just initially help acknowledge all that's going on. And we're looking to continuing to work with the McMaster research team in providing some ongoing supports. I know that Sue's team was able to provide some on-demand support for staff, but the research platform is going to be more of a standardized support for all the staff will be able to access, because I think staff are so busy working, supporting their families, that I don't think necessarily that all staff have taken the time to address or reach out for the supports that they need. And so we're looking forward to the results from the research platform and the supports that research will be able to provide all of our staff. It's been a long 90 weeks. I think realistically we have another 90 weeks to go until we're able to resume our full hours, resume core in-person programming, because we continue to do that virtual programming. And we all acknowledge that there is a barrier there. All of our virtual reference, all of our virtual programming is available to folks who have access to devices and the internet. And a good chunk of our population accesses the library because they don't have access to technology or devices. And so if they aren't able to access our spaces right now, that gap continues to exist, and that is a huge challenge for our staff that we continue to address, and a huge barrier for our members that we are actively looking to find creative ways to make those connections. But the platform really has been invaluable to us, and just being able to hear from other folks that we're working on this together has been helpful, because none of us alone is going to be a solution to post-pandemic response or a resilient recovery for our community. But I know together that our creative solutions and just aligning our best practices together is going to be what's best for both of our staff and everyone who lives, works, and studies in Hamilton, because I know most of us are committed to that whole population and serving them.
Thank you so much, Lisa, for that. And I just remember you telling us, and I think it was kind of around June when you were, or even during that lockdown period where library branches had tried to move Wi-Fi extenders and things closer to windows so that folks could even come and set up in the parking lots or adjacent to the buildings to get Wi-Fi, because so many folks don't have that access. So
yeah, and we were lucky other community partners came at that same time and were able to provide meals to people, because we are often a connector to just different social agencies. And I know that's a lot of the work that Sue's team does as well. Not being able to see people in place doesn't necessarily just mean that our organization wasn't able to help people. We weren't able to connect people to the other organizations that would have been able to provide them with the supports that they were looking for. So, yeah.
Thanks so much, Lisa, for that. And I'm now going to move over to Caitlin. And Caitlin occupies a very unique position. And I'm going to ask Caitlin to share a little bit about her role as a researcher in residence at HPL and the work that she's doing to help inform sort of the development of a framework for how to support university public library research partnerships. And maybe, Caitlin, then you can speak to how you see this helping to support some of the initiatives happening at HPL.
Yeah, for sure. Thanks, Leora. So for a little bit of background, so I've been at HPL for almost 6 months now, which is kind of crazy. So I feel really lucky to be there. As Lisa mentioned, it's a really great place, and yeah. And so for some background, I have a MyTax Accelerate grant, and if you're not familiar with MyTax, it's a Canadian nonprofit that they help connect student researchers, graduate and postdoctoral fellows with industry, nonprofit, and public sector organizations to do a research project. And so my research project, it's a little bit meta in the sense that I am researching research partnerships between public libraries and universities. So at HPL, I have, I'd say, 3 kind of key roles. As part of my project, I'm doing a survey of public library workers in Canada, and I want to get their perspectives on research and to better understand kind of their research questions. And hopefully I can kind of take that and help university researchers better understand the public library context to kind of improve collaboration. And then the second component of my role is that I've been kind of drafting a toolkit or a framework for public libraries. And my hope is that this will be a resource that will help them kind of navigate the process of establishing partnerships. And then my third kind of component of my role is actually helping to facilitate partnerships between McMaster and HPL. And so HPL is, I think they're quite a leader when it comes to doing research with a university in the public library world. They're involved in a really impressive amount of projects. And as Lisa noted, public library workers are super busy, just in the community, helping people address their various needs and kind of pursue their interests. So in this role, I mostly do smaller tasks such as, grant writing and liaisoning, drafting letters of support. And I see this role as kind of that kind of practical aspect, but it's also maybe a bit symbolic in the sense that I'm kind of connecting McMaster and HPL, so I'm a kind of formal connecting piece. And I think how I see this benefiting kind of both HPL, but also really McMaster, is that public libraries and universities, they have a lot to gain from partnering, in the sense that public libraries They can help, university researchers establish really meaningful research questions, as Sue noted, and help us to connect to participants in an equitable way and disseminate findings. And I think that on the public library side, university researchers can help them help answer questions that are maybe difficult to answer when they are so busy. So in my role, I kind of hope to kind of increase or help HPL kind of maintain their research capacity.
Thank you so much, Caitlin. I'm going to move on to Diana now. So Diana has actually worked with both CMHA and HPL on various projects through the community research platform. So Diana, can you share with us a little bit more about your mental health research and why you believe it's important to undertake research like this in partnership with community organizations?
Yes, absolutely. Thank you, Leora. So my research is primarily focused on work and health, so in particular mental health. I particularly examine how emotions intersect with work and look at the influence that performing emotional labor has on the mental health of service workers. And so for those of you who are not familiar with emotional labor, it's a sociological concept that describes the phenomena where individuals who work in service occupations are required to manage their emotions in order to present themselves and interact with others in specific ways that are dependent on the type of service they're providing to the public. And so my research team and I are extremely lucky to have the opportunity to work with Sue and her team at CMHA and Lisa and her team at the Hamilton Public Library on a project entitled Emotions Matter: Skill Building, Emotional Resilience, and Social Support for Service Workers, which is the study that both Sue and Lisa spoke about. So the focus of that project is to address the need for evidence-based research to help inform the development of supportive workplace resources and also strategies to promote emotional resiliency among community care professionals and library workers. This is in the form of developing a peer support program and resources of emotional labor skill building and training. And the results of the survey that we conducted are going to be used to then inform these initiatives. And so, we know from the research on emotional labor that there are mental health consequences for individuals who work in occupations that are emotional labor intensive without supportive resources to help them successfully engage in managing their emotions. So the concern is that over time, and working in unfavorable conditions like the pandemic can result in burnout and psychological distress. So I think having the opportunity to undertake this research in partnership with both community organizations allows us to demonstrate the differences in the on-the-ground experiences of emotional labor in the context of two contrasting occupations. So mental health and addictions, essentially care work, and library workers who, serve members of the community with a range of different services, some of which are social, technical, reference services. We see through this study that emotional labor is truly multidimensional, and it occurs with varying degrees of intensity and frequency across occupations, which will in turn have, of course, varying mental health consequences depending on the context. I also think that partnering with community organizations in general on community engaged research initiatives really provides a number of benefits to knowledge production and knowledge mobilization beyond the scope of what can be done without the collaboration. There's a unique opportunity to answer the so what question that scholars tend to get asked. And because not only are you, contributing to the advancement of scholarly knowledge in a particular area of research, but at the same time, you can also expand the scope of knowledge mobilization activities that can address key issues and problems on the ground with, not only the support and expertise of community leaders, but also the resources and the networks available that can really help accomplish these initiatives.
Thank you so much, Diana. And now we're going to hear from James Gillett. And so, James, I have sort of a broader question for you. as the initiator of the community research platform, the person with the idea to make this happen. So McMaster has made a commitment to advancing research and training that responds to the needs and aspirations of local communities. What do you see as some of the challenges, or I guess previous challenges, with connecting researchers and community organizations? And how do you feel the CRP's unique platform model has helped to address these and advance sustainable and impactful partnered research?
Thanks, Leora, and you've been such an important part of all of it. I feel like I'm, in a way, speaking for both of us. So if you feel like there's anything I missed or anything you want to add, feel free to jump in. I think, prior to COVID, in my own experience doing this kind of research, and also knowing a lot of colleagues who were also doing community engaged research, and having worked with a number of local organizations around research, one of the things that I noticed and my colleagues noticed was that it just took a lot of work when you're on a project to work with an organization, and it was a lot of work for the organization to work on a project, and projects tend to be time defined and topic defined. So you might start one, and then it might last a couple of years, and then it might end, or it might transition to something else. But it was a lot of energy went to just maintaining the relationship and making sure that it was as best as possible, kind of mutually beneficial for all the parties. And so when I started as Associate Dean of Research, we came up with this idea of having a more institutional relationship with organizations, where we would share resources and make a commitment to a longer term kind of organizational relationship around research that would support individual projects by researchers in the faculty and also in the community. And so that was kind of the idea behind it, and had these wonderful local organizations who were willing to kind of try it out, because I think many were had experience doing research and wanted to expand that in relation to their organization, but to devote that amount of time and energy to research when that's often not the mandate of organizations. So in situations perhaps like the library or other organizations, if you were to look at the objectives of a public library, doing research, even though that is part of what happens in a library, it isn't necessarily kind of on the front page of the kinds of things that it might do, but could and does, and that's one of the things we've really tried to work towards, is to think about where with the library how research fits into it, and so I feel like that was the kind of underlying idea behind it, and it's taken all kinds of really interesting directions. And I feel like with something like COVID, on the one hand, it made it more challenging because many organizations had to kind of pivot dramatically in response to the epidemic, but also at the same time we were forced to work more digitally, and so we could have meetings and get together and kind of respond to the epidemic kind of collectively and continue the work that we were doing through a kind of digital platform as opposed to meeting in person. And in some ways I feel like that having to kind of become more comfortable with the way in which things can be done digitally across, kind of overcoming the boundaries of space was really an interesting part of it. And I feel like we may have gotten even more done during that time than if we had to meet in person all the time across all the various things that we're we're doing. So I'm really encouraged and have really enjoyed doing this, and I feel like if the university really wants to make a commitment or is really imagining itself as a kind of civic university, being able to create a means by which we can share our research infrastructure with organizations in the region in order to kind of advance both scholarship in areas, but also the kinds of priorities and objectives that local community organizations have for citizens and communities. That's really an important piece and something that we've seen as being kind of even more important when we collectively have to respond to things like COVID or other kinds of crises that may emerge in the future that requires a kind of a pivot and the place of organizations to meet the changing needs of people in response to those crises. So I'll maybe stop there, and you're welcome, Leora, to add anything more that comes to mind, and can pass it on, and leave time also for some questions if folks have some.
Absolutely. And I'll go to Rachel in just 1 second. I think you covered it, James. I would just add that we've done a few interesting things in terms of trying to really break down that like academic community partner divide, and one of the initiatives was to actually appoint some leads from community organizations as adjunct professors. So Sue has been appointed as an adjunct, and then on the other side of that, having for example Caitlin's role, which is a researcher in residence at HPL. So these opportunities to really embed scholars in community organizations and community experts in academia to really benefit from each other's knowledge and expertise. And also we get asked the question of like, we keep referring to, infrastructure sharing, and like, what exactly do we mean by it? Like, what kind of infrastructure? And so it can be physical things. I mean, not during the pandemic, but in the future, like sharing space, academics accessing community spaces, community accessing spaces on campus. It can be equipment, technology, things like that. But it really is around the knowledge and the expertise that we're talking about. And also something that one of our colleagues, Emil Joseph, referred to as relational infrastructure. So I think, we really, several folks on the panel have pointed to, maintaining and building these kinds of relationships takes a lot of time and energy. And to really do this right and to maintain it over the long term, not just attached to one-off projects, you really have to invest in building those relationships. And so that's something that the platform has really tried to do, is build those relationships. And then we also are able, as a result, to respond to things more quickly, whether it's a grant proposal or whether it's, a request from community or something from academia, or even this panel today. I was able to, very quickly reach out to Lisa and Sue and say, hey, can you participate in this? And, without having that, relationship built on trust that we've been, working together over a longer period of time, it's very hard to do those things quickly. And I think opportunities can often be missed as a result. And we've been able to really jump on things that maybe otherwise we wouldn't have been able to do. But I'll leave it there because I really would like to hear from Rachel Van Every. And so Rachel was heavily involved in one of our projects with CMHA Hamilton. And so, Rachel, I'm going to ask, could you please tell us a little bit about the project that you were involved in, what your role was, and then really wanted to hear from you as a doctoral student, what has it meant for your own research and training to be involved in this type of community-engaged research?
Yeah, okay. I think I'm unmuted. Okay. I just first wanted to thank McMaster University for inviting me to share my perspective on university community engaged research and the impact working with community has had on my own research training. The project that I was involved in with CMHA is the Intensive Supports Pilot Project, which is a strategic community-driven collaboration between CMHA Hamilton, St. Joseph's Healthcare, the City of Hamilton, and also the newly addition of the Coalition of Hamilton Indigenous Leadership. So the project was in response to the encampments in COVID-19, as mentioned by Sue, and the need for permanent solutions to chronic homelessness. The ISP project aimed to stabilize the housing of 15 to 20 individuals experiencing chronic homelessness with high acuity mental illness and or substance use disorder through coordination of clinical and non-clinical supports. So our role as the research team was to assess the effectiveness of the new collaboration. And my role as a student researcher in the project primarily consisted of engaging with stakeholders involved in the project. I was invited to weekly team meetings with project collaborators, and I had the opportunity to engage virtually with organizations in Hamilton, and specifically with a focus on Indigenous organizations. I'm very thankful for those who took the time to meet with me and share their expertise and suggestions on how this project can be strengthened to support persons experiencing chronic homelessness. So because of the intersections of needs by clients in encampments throughout the program evaluation, I was able to learn and ask questions about this new multi-pronged community of care practice that is inclusive of housing and healthcare that form directly from client need rather than the organizational philosophies and resource structures. Just to share some of the findings from the Staying Home evaluation report that was led by doctoral candidate Samantha Peretta and also Jeffrey Black, Dr. Gillett, and myself. So each organization approached the ISP open-minded and a willingness to share community resources and expertise employing systems really formatted in a virtual roundtable talk to create immediate viable solutions that support individuals of high acuity and are experiencing chronic homelessness. So the ISP has created a community-engaged model that other municipalities can integrate into their service of clients and work towards a common goal while creating a culture of shared accountability and mutual respect, something that's very important to me with community research. And the ISP project was in its infancy when the program evaluation took place, really recognizing the need to advance this research and look at the long-term benefits of intensive supports pilot projects, including this project here in Hamilton. In regards to my involvement in community-engaged research and how it impacted my research training more specifically, I found that being involved in community-engaged research really allowed me to employ the skills acquired from my background in nursing and public health and learn from the voices of the community and be a part of creating solutions that are garnered by scientific evidence and lived experience. So for me, community-engaged research allows for a range of mentorship opportunities with experienced researchers and community representatives. And I guess just lastly, working collaboratively with a research team like the platform that I was a part of provided me with an opportunity to create relationships and connect with networks of a variety of scholars who are also invested in community-engaged research like myself. Thank you.
Thank you so much for that, Rachel. And I have one final question to put to our panelists, and then I will open it up to questions from participants. So the last question, and maybe Sue or Lisa, I'll go to you first. How do you think academia can best support the work of community organizations and the public library around mental health and well-being programs moving forward? And what might be some resources that could be leveraged to help with this work?
So I'll just echo everything that Caitlin said. I think that creating opportunities for us to work together through a platform like this, where folks like Sue and I and the Y and some art organizations have come together and share our best practices and share our resources to support everyone who lives, works, and studies in Hamilton is great. And really, it might seem like it's not a big deal to gather us, but the number of emails and the coordination that needs to happen and setting that agenda and then doing all that follow-up, that is huge because it doesn't happen otherwise. Because if it was so easy to do, we would have already been doing it, and we wouldn't be sitting here in this panel talking about how important it is, the work that Leora, I know that you take the main lead on, literally like herding us all together for that meeting. And it's hard. There's the doodles, there's the resetting of the dates, and so that is huge. And then I think the other piece is that embedded piece. So having someone embedded like Caitlin, who is, she hit the ground running in the middle of a global pandemic, learning about the library and learning how to the supports that would be useful for us. But as she becomes more intimate with the work of public libraries, she's learning and then making those connections with academia. So from the HPL side, we're not getting that involved with the academic knowledge, like gaining more knowledge about what's happening in the world of academics. But Caitlin is constantly bringing us stuff that says, hey, I found this other puzzle piece. It connects to what you're doing here. So having that embedded piece, I really feel like has made a huge difference. And then there's things that James and Caitlin will both bring up that, again, make so much sense, but we haven't had the opportunity, the time to bring those pieces together. So, you talked about trust. It's trust and vulnerability that we accept at the library, that MAC isn't coming in, the research partners aren't coming in to change or evaluate, or, well, I shouldn't say evaluate in a negative way, like evaluate definitely in a research way, but there's no judgment or anything happening. We are trusting our partnership, that we are working together to that same goal of whether it's freedom to discover, being a beacon in our community, or expanding resources. And McMaster comes in as the whole research platform comes in with so many different experiences and knowledge pieces, and we're all able to benefit from that. So I hope that all made sense, because I'm super passionate about the work that's happening here, because it really is, the return on investment has been huge. In all the different ways that we've been able to connect. And James is right, the virtual meetings have been super productive, and we've gotten a lot more stuff done. And as things ramp up in all of our worlds, this will continue, I think, really to be a foundational piece in us growing and even being a stronger community resource with our partners.
Thank you, Lisa. Sue, any thoughts on sort of what the future holds, what we can do moving forward? From the academic side, are there other ways that we could best support the work that you do as we move out of the pandemic?
Yeah, I mean, of course, I would echo everything, and I just want to thank Rachel so much for articulating so well what had been done with the ISP project too, because that was a really important collaboration and learning experience for all of us. And as Rachel said, that really, was at a time where it was at a very, very early stage with so much learning, and so it was such an important point where we came together. But there's just three other points that I wanted to make about kind of the benefits and then how I see this moving forward. So at this time, through the province, we have now a mental health and addiction center of excellence that is looking at quality core mental health services. And so quality improvement is a huge part of what they're looking at, and they really want good data. They want more than just what previously we used to provide to the ministry, which funds our services, was more quantitative data, but now they want to know more about the quality and more qualitative data, and how we can improve both the client experience as well as the provider experience. And so I think Diana's work is going to be essential in really helping to inform what we can do to support the provider experience going forward. That's also one of the four outcome measures that Ontario Health is now looking at is the provider experience too. So I think even in terms of being an accredited organization with Accreditation Canada and the quality dimensions that we have to consider as an organization within healthcare, I think McMaster is going to be instrumental, and this community research platform is going to be absolutely essential going forward to us to be able to just stay on top of those quality improvement initiatives, I think. as James was mentioning around just being responsive to the changing needs within our community, like this is where, as a small community organization, we don't have that infrastructure internally to really, continually evaluate what we're doing to ensure that it's meeting the needs of the community as it changes. And we see, these escalating mental health issues and these really, really illicit and toxic drugs that are changing the profile of the people that we serve and the behaviors associated with that, and how those behaviors then impact their ability to access services in an equitable way, to be able to maintain housing and so on. And those are all the realms for which we, function every day and have to provide service to our community. So just being able to be on top of that, to be continually responsive to that, I think ensuring that what we're doing is evidence-based and also incorporating that lived experience, as Rachel mentioned, is also essential. And I don't think we can do that without the help of this platform. I really honestly don't. And, thirdly, the relationship building. And, as Dr. Joseph mentioned about the relational infrastructure, like I agree, like we've worked now on projects with Emile, to do with grief and loss and loneliness, and creating a platform that's accessible to our staff too, to be able to support them in the work that they do, as well as the community. And then, consequently, we were able also, because of that relationship, to broaden that, to be able to support CMHA Ontario with some of the work that they're doing around loneliness. And then, additionally, like I was able to, sort of share that Dr. Emile Joseph had some really important work and expertise around, mental health and sort of, the racialized individuals and inequities that they faced within the system. And he came to speak to our staff about that. And that was just so important. And it was such a great learning experience for our staff. And, these things do take time and energy, and it is an investment. And what's really important to me is that, I don't want it to stop with me. So I want this to go beyond me to the board of directors, so that they understand how important this is with, our values of providing equitable services. And, even the work that, Rachel has done to kind of help us to understand our Indigenous communities and how we can make our services more accessible and equitable, with the ISP project. Like, I think those key learnings will just kind of flow into the other services that we provide, to be able to really tweak and improve what we offer, so that it is more culturally sensitive. And so I think, we're going to have the community research platform come and present to our board of directors, so that they can really understand what it is that we're doing and how valuable and important that is, so that, when we talk about resources and what resources we need to put forward, that every time we think about a new program, every time we put together a funding application for, something else that's responsive and meeting the needs of our community, that we incorporate that research and evaluation for quality improvement into that proposal. And I think, these are the things that we have to ensure going forward, so that we can maintain this excellent partnership. So I'm equally as excited by this as everyone here, I think. So thank you very much.
Thank you so much, Sue. And I'm just looking, so we have about 15 minutes, and I want to make sure that I leave some time for anyone participating in this panel to ask any questions. So just a reminder that if you have a question, to use the chat function in the bottom left of your screen. So similar to with Zoom, you just click on the chat and then direct your question, use the arrow for the drop down, and then find my name, Leora, and direct your question to me, and then I can put it to the panelists. So I see that we have one question here already. So this question is directed to Diana, Rachel, or Caitlin, or all of you. As early career researchers, what is one of the main challenges you faced in collaborations with community organizations? And what advice would you provide to other early career researchers looking to embark in similar types of collaborative projects? Who would like to take this on? Oh, Caitlin, thank you.
Yeah, I can add in. I think the part of the question that kind of tripped me up initially was the challenges, because I think I so often just think about the rewards of partnering with the community. And I think maybe as a tip for kind of new or other early researchers or undergraduate students or graduate students who are interested in getting involved in community research, I have a few things actually. One, I suggest that you should do it because I think that it can make your research feel a lot more meaningful, and I think it can be more meaningful when it's with a community group, and that can be super motivating. When it's late at night and you want to meet a deadline, remembering that your project, is going to help someone. So that's just one little tip. And then, but for challenges, I think sometimes it can be intimidating to kind of establish the partnership, to maybe reach out, whether it's like whoever in the community that you want to work with, making that kind of is that a cold email or a cold call. And here I think sometimes it can just kind of thinking about what skills you have to offer, and to be confident. And to even work towards establishing that relationship ahead of time, volunteering or that kind of work.
Thanks, Caitlin. Diana, did you want to add to that?
Yeah, I just wanted to say, echoing similar things that Caitlin mentioned, I feel incredibly lucky to have been able to work with Sue and her team, and also Lisa and her team, and then being a part of the community research platform. I think that, the challenges that I faced as an early career researcher were more COVID related, as opposed to being able to really get the community engaged research going, because we did have, this platform. And so I think that any advice that I would give to an early career researcher is try to, find a similar way to connect with community organizations, and build those connections from an existing network.
And Rachel, I didn't know if I can't see where you went here on my screen. Are you still there, Rachel? I can't see Rachel. Okay, we might have lost Rachel. I just wanted to add to that too. I think one of the things that we've really, with establishing the platform, is just recognizing that oftentimes community organizations, and definitely the public library, get inundated with research requests. And that was one of, actually, in our very initial conversations with HPL specifically, but it's not unique to HPL. That sometimes when you're, really immersed in your own project, and, you have these deadlines, and you reach out to a community partner, and there can sometimes be this, friction, because, you're hoping to engage the partner, but the partner, you haven't built that relationship, that trust, and they're really, really busy doing the on-the-ground work. And so one of the ideas behind the platform was that if the relationship could be, fostered at that institutional level, where we're in regular contact, where there is that trust and understanding, and where we've talked about, what our mutual interests, where we can help facilitate that relationship, and also take some of the burden off the community organization in terms of fielding different research requests and things like that. But again, I mean, there are 5 organizations involved in this, and there are other researchers who do, of course, partner with other organizations. And I think what Caitlin highlighted about starting early, and really not waiting till you have a grant deadline in 3 weeks to try and get a community organization on board, really thinking about months before then, building that relationship, getting to know that partner, understanding what their needs are, why they might be interested in the research, where is there opportunity for them to help inform the research questions, and give input into that process. And overall, you'll have much more relevant, meaningful research experience.
Leora, could I just throw something in there too?
Yeah, absolutely.
So just an observer of all the amazing work that Caitlin's been doing, I wasn't really sure if the researcher in residence could actually work virtual middle of a global pandemic. I feel like a big part of Caitlin's work has been through her network, because the research toolkit that she's working on, the whole plan was that librarians, library CEOs were going to help support her, give her feedback, review it, and there was going to be this whole organic process. That just hasn't been possible because we've been working through just opening hours and staffing and things like that. So Caitlin has continued to meet every single timeline, exceed every single expectation, because people like Dr. Diana Singh and other people who are in her network continue to work with her. Like, she has this strong research network who she's been able to bring in to fill some of the roles that the library community were supposed to be giving her. And she's just, she keeps feeding us small pieces so we can give her smaller pieces of feedback instead of doing the whole work that, should be expected of us, but we're just not able to do it because we're still restarting our other services. So I just feel like Caitlin's whole network has been invaluable in this researcher and residence program too. Caitlin, definitely jump in if I'm wrong, but I often feel like I get a lot of emails from you about how you're going to go to your own network and your own group of researchers that you're working with to help support us in some of the work that we're doing.
Yeah, no, I feel very well supported, both at HPL. I wouldn't be too hard on, HPL stuff. I think you've given me a lot of support, but definitely at McMaster, yeah, for sure.
Oh, I think you're muted, Leora.
Thanks, James. Sorry, I have two more questions here in the chat. So this one is, one question I have would be, how has engagement with programming been since the reopening after lockdowns? And how are researchers and community partners navigating those challenges within their studies? So maybe Diana or Caitlin, Rachel or James, in terms of how research is proceeding now that things are starting to reopen. Did I get that question correct? I think that was Jessica.
I can say a little bit. I think that I think for a long time during the pandemic, or at least during when we were in like phase 1 and phase 2 of it, there really wasn't very much research happening. Everything it was very challenging to do it, and I think there was like with the teaching, there has been this kind of shift to other digital platforms like Zoom to do interviews and things like that. So I feel like a lot of the work that way has shifted to a more digital platform, like with a lot of other aspects of our lives, and I think the training piece as well has shifted. So like we have a social work placement who's involved in the platform this year for the first time, and that's all been done digitally, like through Zoom and other digital platforms. So a lot of the research is, at least on the research side of things, it's gone that way. I imagine it's been similar for organizations.
I was just going to add, for the intensive support pilot project, and maybe Rachel and James, also yourself, can speak to this, but I know you interviewed like 30 people or more as part of that project, some case managers and folks who were in the program, and then peer support workers. Maybe just to that point about how did you make that work kind of in the COVID context? How did you connect with folks, and how did that piece go?
I can speak to that again. I mean, I think we... it was interesting with I'm just thinking about just CMHA and Sue. I mean, it was interesting because on the one hand, CMHA was kind of open in person in many ways, and so there was this, when the intensive case managers were out in the world, they were meeting with folks face to face, but then also through their cell phones or maybe other ways. And so we were able to, leverage our connection to them to make connections to other people to talk with. So, but then when we spoke with them, it would have been over the phone or sometimes it's Zoom. But it was probably a combination of just talking to someone over the phone or doing it over Zoom. So it's always sort of a bit of a double-edged sword. It was you lost a little bit, I think, because you're doing it all remotely and digitally. But then I think in some ways people felt more comfortable and it was more convenient to just jump on Zoom and have an hour-long conversation than to say, hey, let's meet at this cafe and this is what I look like, and it's there's so much more time to do an in-person interview with someone than it is to just jump on Zoom. So I feel like it's been there's been some things gained and some things lost. I don't know if others have comments they want to make.
Yeah, is there anyone else that wanted to add to that question around doing this type of research in a COVID context and as we move out of COVID, as things have started to reopen? Okay, we have two more questions here in the chat. So let me just scroll here. Okay, I had a comment and a question that would be easier for me to elaborate verbally. Is that a possibility? Okay, sure. So Ali, if you want to unmute yourself, you should be able to ask the question to the whole panel. Are you there, Ali?
Sorry, Leora, I think Ali will need to come to one of the orange speakers in order to address the room.
Okay. So maybe while Ali's making her way, their way, sorry.
Is everyone hearing me now?
Yes, I can
Yeah.
hear you. I don't know. I'm not sure if everyone can.
Yeah.
I can.
I can. Yeah.
Okay, seems like everyone can. Go ahead, Ali.
Well, thank you so much for all the information that was shared through this panel, and I learned a lot. And as someone who works in a public library in the region of Waterloo, well, I'm not representing my library that I work here. I'm in the first place a PhD student at McMaster in Health and Society Department, but I can validate a lot of things that have been shared through this panel. Through my first-hand experience of frontline work in the library. In terms of the comments, what I found through my observation of the services that are provided through the libraries within the pandemic, I can definitely validate that a lot of library users have been missed from the library and have never been come back because of several lockdowns that interrupted for several times and several weeks. But the most important things that I have noticed is that a lot of library programs that are designed are mostly targeted toward middle-class families rather than, especially through the terms of pandemic. First of all, because of access to technology and internet and having the kind of lifestyle that they can attend a library program virtually during the working hours is something that not all people, especially people from marginalized groups and people from low-income families, can afford. The other thing that I've noticed is that a lot of library programs that entail having a program kits, make and take, or craft of making are amazing programs, but they mostly are targeted toward middle-class families that can afford having a car to come to the library in the curbside pickup to do the pickup. And it is not worthy for a family who doesn't have a car to spend all the bus ticket to come to the library to pick up library material that is designed for library programs. So with all this context and the fact that how pandemic has changed a lot of things that we do in the libraries, and it has become so crucial that libraries play a crucial role in cultural and social well-being of our communities. Other aspects that I've noticed as part of the problem is, at least to my knowledge of the region of Waterloo, and this is not specific to one specific library in the region of Waterloo. I've been to several of them. A lot of community libraries have not yet been diversified in terms of the employees who work in the libraries to recognize and address the issues of the diverse community that they're serving in terms of marginalized groups, in terms of immigrant groups that live in those communities. It would be very hard for me to know very clearly what the issues or what the needs of the white class, middle class family are in the community that I'm serving. So that diversification of employees is one thing, and the other thing is,
Alex, sorry, I don't mean to interrupt you. I just want to let you know we only have a few moments left, so I'm just wondering did you have a specific question, maybe to direct to Lisa from the library?
Yeah, and also, yeah, for sure. So basically, my question would be, what has been done and what can be done in terms of reevaluation of the services that can be provided in the library system, and also with partnership with Canadian Mental Health, that address those issues post-pandemic in terms of the design of the programs and how libraries' functionality can be changed from just specifically a place for printing and borrowing books to adding to the mental health, mental well-being of the communities.
Great question, Ali. Thank you so much. So the research that we're participating with Dr. Diana Singh is actually with a group of libraries, and I know that for sure part of that research did include some equity, diversity, and inclusion pieces too, so we're looking forward to those follow-ups. Most public libraries coming out of the pandemic have had greater awareness and greater gap knowledge awareness of various services. We are working very closely in Hamilton with our urban Indigenous strategy to respond to not only acknowledging treaties, but being more aware of our practices in relation to being respectful to the land that we work on and acknowledging it in our various programs that we're doing. And then definitely whether it was through the Black Lives Matters or other things that have happened in our society and just become more exaggerated over the last 2 years, a lot of libraries too are working, whether it's collaboratively or with various consultants on equity, diversity, and inclusion. And diversification in the library workplace has been an issue for the last 25 years that I've been a librarian, and will continue to be a goal that many librarians and libraries are working towards. I know locally in Ontario, most libraries have that as a strong priority focus over the last 5 years. I know in British Columbia, they have been a lot more successful. And I think as we look at the barriers that are going to library school, having that master's degree, just the cost of that too, also getting a second college degree for library technicians will continue to be a barrier. But there's many of us actively working with both library schools and the library community in general to address everything, and the change is not going to happen overnight. It is being worked on, and I know that with the research toolkit too, Caitlin has that part of the foundational toolkit that we will be rolling out with all the Canadian urban libraries to consider whether it's programming or other evaluations pieces that we all need to work on. It'll be there. So thank you, Ali, for bringing up something that has been talked about, I think, a little bit quieter over the last 2 decades, but is definitely at the forefront of the work that we're doing right now. And again, thanks to community partners like the Urban Indigenous Strategy, and I think this research platform too, it will be spoken of more clearly and more in the forefront than it has been in the past.
Thank you, Ali and Lisa. And I would say too, Lisa, just the recent conversations we've had, and with our social work student who's doing work with HPL, looking at what the role of social work is within the library context, and acknowledging that, library workers are encountering situations where they haven't necessarily been trained to be able to respond to some of the challenges that, or different situations that library members are facing. And so the library's commitment to bringing other partners on board to help fill those gaps and support them in that work and meeting the needs of all the members that are accessing spaces, I think is a really crucial piece and commitment. And so we're happy to, be supporting a student who's working with HPL on that piece. Okay, just final question, and then unfortunately we're going to have to wrap up, but this has been such a wonderful discussion. So this question was actually from Marissa to James, and I really like this question. Can we write funding support for the CRP into our grants as faculty? My reasoning stems from the fact that we need a platform like this to take the burden off community organizations who do not have the resources to facilitate these collaborations, like Lisa suggested about HPL.
Yes, so I can answer that question, and the answer is yes. That was part of the I think part of the idea behind it in some respects was that this could be seen as either an in-kind contribution that the faculty and the university can make to kind of research grants, or it's something that could be built into grants to help provide support. So I think that's a good idea, and Leora and I would be the person to reach out to if you're interested in chatting more about how that might work.
So at this point, I just want to take the opportunity to say thank you so much to our panelists today for taking the time to speak and share your experiences and your knowledge on community university research partnerships around mental health initiatives, and as well to just extend my thank you to this panel, because everyone on this panel has played an integral role in the community research platform, and I really cannot believe what's been achieved in such a short time, even with the pandemic happening. So thank you all so much, and thank you very much for everyone who's participated today. And if you have any follow-up questions at all, I can maybe have Marissa just share my contact information, and happy to then pass along questions to any panelists if there was something that comes to mind after the panel. And now I'll just pass it over to Marissa just to conclude.
Thank you so much, Leora, and I echo your gratitude for all of our panelists. Thank you so much. That was incredibly insightful, and I learned a lot about some of these collaborations, but also learned a lot more about what's happening with CMHA and Hamilton Public Libraries. So thank you. I will just quickly conclude by giving an extended thank you to Leora for organizing and moderating this panel. We are now going to, in the symposium, for those of you who can continue to participate, I know everyone is busy, so maybe not, the next hour we have actually scheduled as wellness time, and we are encouraging people to step away from the screen for at least 15 minutes. We do have an hour break now until the Spotlight event, which is going to be a keynote discussion by Professor Jason Schnicker from the University of Pennsylvania, and it's going to be on his new book, Unnerved, Anxiety, Social Change, and the Transformation of Modern Mental Health, which I think is applicable to all of the discussions today, as well as what we will consider within a post-COVID time period if we ever get there. So I am going to then sign off with giving you that information, encourage you to come, and thank you again for being part of the ARM Symposium.